For GPs and their staff, just like doctors and nurses in hospitals, the increase in cases means gearing up again. Dr. Karen Price is the president of the Royal Australian College of General Practitioners. I spoke to her earlier in Alice Springs. Dr. Price, welcome to the programme.
Thank you for having me.
What's the impact going to be on frontline workers of a large wave of cases?
Well, the workforce is standing ready to serve the communities, but of course it's a pretty tired workforce, but of course we respond to what is going to be a pretty significant winter surge of infectious disease, including COVID.
What are GPs asking the community to do in face of that winter wave?
Well, we're certainly asking for everybody to do as much as they possibly can to limit their exposure to infectious disease, and particularly COVID. So certainly go about having your third and fourth boosters if you're eligible. And then we certainly are asking for people to consider wearing a mask in most situations to limit their exposure to COVID and also their transmission of any other respiratory viruses. So also ventilation, the usual public health measures of staying home if you're unwell, and utilising telehealth if you do need to contact your local GP.
There's still more than 5 million Australians who haven't had their booster doses, third and fourth. How do you persuade those people that it's good for them and good for the rest of the community to do that?
I think there's a lot of confusing messages about what vaccination is supposed to do. Vaccination has always been, and it's been said by many, there to prevent you getting very severely unwell with COVID. You still may get COVID, but it'll be very mild cold that you can manage at home with some paracetamol or other analgesics if anything needed at all. So it's there to stop you going into hospital, it's there to stop you going into ICU, intensive care, and it's there to stop you, having an even worse outcome. It's also there to, potentially if you don't get COVID, then you're not going to spread it to other people who may be vulnerable and unable to mount an immune response. So it's a really good thing for you to do for yourself, and it's a really good thing to do for the community.
You said that Australia's GPs are ready to step up again in the face of this wave, but tell me, how exhausted are they as a group?
Look, every Australian needs to thank their GP. They need to thank their GP staff, the nurses, the receptionists, who've all stepped up under difficult circumstances to support their local communities. They've educated, they've adapted again and again to all the changes, and they'll continue to do so. But they are very exhausted, but they'll continue to step up for their communities because they can understand how important this is for the whole of Australia to get back on track with COVID and other respiratory illnesses.
Let me just ask you a question about the antiviral medicines. Are they reaching the GPs? There were some issues with a very large number of those medicines being warehoused and waiting to get out. Are they getting out to patients?
They are getting out to patients. There's been a lot of antiviral prescriptions going on, and there's certainly been a big uptick in the last little bit, and we're pleased to see people now getting awareness that they may well be eligible for an antiviral. There's been a little bit of a patchy response in the pharmacists not always having them on the shelf, but I think that's being slowly resolved as this obviously is uptick in respiratory illness goes on. So sometimes GPs have to spend a bit of time trying to work out where they can get their patient their antiviral, but hopefully that's being sorted out, and each GP should probably know by now which local pharmacy has that in stock.
Dr. Karen Price, thank you very much indeed for joining us.
It's been a pleasure. Thank you.